When planning for retirement, many people think they're covered once Medicare kicks in. But the reality is, healthcare costs can take a big bite out of your retirement plan. We'll talk about it today on Elevate Wealth. Hey there, I'm Deanne Rosso with Elevate Wealth Advisory, and joining me today is Clarke Holt, Senior Wealth Advisor with Elevate Wealth Advisory. Just celebrated his 22nd anniversary with our firm. Congratulations, Clarke.
Thank you.
So thank you for being here, and let's start with this. What are the biggest blind spots that people have when it comes to healthcare in retirement?
So one of the most overlooked parts of retirement planning is healthcare cost, and people don't think about it. And so it's not just about the coverage you have, it's about the surprises, the gaps, things like that, and just that overall long-term cost of healthcare in retirement.
Yeah.
So many people assume that Medicare is going to cover everything. And in fact, it doesn't cover dental or vision, it might not cover some or certain medications, and it won't cover long-term care. And so you're likely to face some out-of-pocket cost in retirement.
Wow. So, I know a lot of people don't necessarily plan for that type of cost. So it seems like, are there some average numbers around what you can expect for how much money you might need on healthcare in retirement?
So a couple retiring today and having that 25 or 35 year retirement could end up having healthcare costs that exceed $300,000.
Oh, wow. That's a lot. And you don't really normally think about that amount of money as being just dedicated for healthcare costs,
Exactly.
especially after Medicare. Mm-hmm. So what can people do to prepare for these costs in retirement?
So we encourage people to participate in HSAs if they're eligible, health savings accounts, explore long-term care insurance, and really set up a dedicated healthcare fund or a healthcare account, almost like the same way we set up IRAs or tax advantaged accounts, and systematically fund that account as much as we can over a long period so we have additional funds to cover those surprises or those gaps.
Absolutely. So things like health savings accounts, long-term care insurance, a dedicated savings account for healthcare costs, all things that we could do in order to prepare for these costs. But of course, every individual situation is going to be different and unique to them. And so if you have questions about how we can help you prepare for those costs in retirement, visit us at elevate-wealth.com and click Let's Talk. Thank you for joining me today, Clarke.
Thank you.
And we'll see you all next time.